Well, everybody, welcome to the Saturday edition of This Day. Always at the desk on these days on April 18th. Good to be here. I'm Michael Taylor. Glad to see you guys. We got a great show for you, so let's get right to it. On today's show, we got Excel Health with Dr. Jeffrey Rowe and Goswami Clinic with Dr. Gaurav Goswami. Right now, though, we want to keep you informed. And Ting, you guys have been talking about Ting. You know it's coming. Some people are already using it. Some people, it's just around the corner. Well, they have a new and easier way for residents to be able to schedule their internet installation. It's a new text option that allows eligible residents to confirm installation appointments quickly and conveniently from their phone. To opt in, there's going to be an email coming to you if you haven't gotten it already. All you have to do is opt in by saying yes to that email. And once you're enrolled, you may receive a text messages with available appointment times. If you don't respond to the text, Ting is going to follow up by giving you a phone call and assist you with the scheduling. So you can get more information by going to tinginternet.com/Laguna Woods Village. There you go, folks. Ting is arriving if you don't already have it yet, so get that scheduling done. Let's take a look at our weather forecast. If you're not indoors watching TV on Ting or something like that, you can go out there and enjoy some really nice warm temperatures for today. We're going to get up to 78 degrees today, then a little cooler on Sunday. Then Monday, we're even cooler with 70 degrees. Tuesday, partly cloudy. We were talking about rain in the forecast earlier this week, but now that seems to be gone. But that cooler front that's coming through, going to bring us some clouds and cooler temperatures, but no rain looks like in the forecast for Monday or Tuesday. There you go, down to the 60s on Wednesday and Tuesday. Let's take a look at a sunrise, sunset, and we got a really beautiful picture here, right here in the village, right? I always say you don't have to go all these vacation spots, just take some pictures here in the village. This is Cindy's garden right here in Laguna Woods Village. Thank you very much, Judy Blando, for taking this picture. Sunrise this morning was 6:17. Sunset tonight is 7:24. All right, so we're gonna throw down the gauntlet now. Who has a better garden? Let's take some garden pictures, folks. I want to see some garden pictures from everybody. Show off those springtime blooms in your yard. Email us those pictures, lagunawoodsvillagetv@gmail.com, and we'll have our garden showdown. Make sure you include your name, where that garden is, and make sure it's in a horizontal picture so we can fit it on the screen. All right, folks, we're going to be taking a quick break. When we come back, we'll be talking with Excel Health and Dr. Jeffrey Rowe. Stay with us.
If you're living with spinal stenosis, sciatica, or any other spine issue, you're not alone. And you do have options. Our minimally invasive procedures mean most patients are walking just hours after surgery. Call Excel Health today and let's talk about what we can do for you.
Welcome back to the show, everyone. How many of you out there love to play your sports, but maybe limited due to back or neck pain? Well, here to give us all the reasons why you don't have to live with that, I've got Dr. Rowe from Excel Neurosurgery and Spine with me today. Hello.
Good morning.
How are you?
Doing well. How are you doing?
I'm great. I don't have any back pain, so I don't have any neck pain, so
that's a good thing, right?
But I will tell you what, sometimes, you kind of wake up with a little kink, right? And you're not even sure where it came from, possibly in your sleep. But you're here to address issues that go beyond just a daily soreness, right? A lot of our viewers here in Laguna Woods Village, as I mentioned, are very, very active, but sometimes they are limited by the pain. So where are you seeing demographics sort of in the 60s, 70s, 80s? What type of category are they falling into in terms of back or neck pain? And it's probably not even, you don't even have to stop at that age. I mean, I noticed in your logo, you had sort of a younger person with just a small Band-Aid across her back. We'll talk about that. But in terms of our viewers today, what are you seeing that's happening the most?
The way I like to think about what's happening to all of us actually as we age is that all moving parts at some point wear down. Just like in a car. You can have brake pads that wear down, you can have tire treads that wear down. The tire can get flat. So it's very similar to all the moving parts that we have in our body, including our joints, including our discs, they can wear out over time. And that's a normal phenomenon. So it happens to everybody. Nobody
Can't escape it.
is immune from that. Where we come in is when there is pressure typically on a nerve and or the spinal cord that causes pain from typically nerve compression. And so we always treat patients, first of all, non-operatively with medications, injections, physical therapy. If those things fail, then we consider other options, very ultra minimally invasive options that can help patients get back to their normal lives.
So you've switched, I assume, from the traditional fusion of the discs, right? When you do have that herniated disc, to what you're mentioning is the ultra minimalization of being able just to chip away or cut away those little herniated discs, right?
Absolutely. In fact, previously the thought was to not only fuse, but do it in an open traditional way. So as a spine surgeon, I can take a look at the spine either by opening up the skin and the soft tissues and literally filleting open the spine. That's traditional spine surgery. And that's why a lot of the outcomes were not so great. But now we've advanced to the point now where we can literally make an incision the size of a pencil eraser, go in with a high definition camera and endoscope, and then with another tiny little incision, we can do all the work that we typically did in an open fashion through this ultra minimally invasive technique.
It's fascinating. And that's all sort of developed within the last 10 years, right?
That's right.
Yes.
So you can kind of think of it this way as well. Like, we evolved from being able to look directly into the spine, then we were able to make smaller and smaller incisions and then use a high-powered microscope to help us look at the spine. But now what we're doing is we're taking that high-powered camera and putting it through a tiny little incision, going down into the spine itself and doing the surgery or the procedure through a very minimally invasive portal.
Dr. Rowe, in the case of like a bone spur, or what are you calling them, a burr or spur?
Bone spur, yes.
A bone spur that also, you may or may not have a herniated disc associated with it, but it's also impinging on a nerve and creating a lot of discomfort and pain. Can you perform the same procedure to remove the spur?
Absolutely. And that spur typically comes from an area around the foramen, which is essentially a hole that the nerve exits out of your spine. Over time, you can develop these bone spurs that then cause what we say is stenosis or pinching of the nerves. But we can now literally go straight down to that area, visualize the nerve and the stenosis that they have, the pinching, and then take tiny little micro instruments and start chipping away at that bone spur, and then take the pressure off the nerve through a very minimally invasive technique.
And that is instant relief.
That is typically instant relief because you're taking the pressure off the nerve, but it also does depend on how long the nerve has been pinched.
Oh, is that right?
Because I like to kind of describe it as a garden hose. If you had a hose that was watering a bed of flowers, and then you ran your truck right directly over that garden hose, that flow would stop. Now, if that pressure on that nerve comes off immediately, then the flow comes back immediately. But in a lot of cases, when that truck has been on that nerve for weeks, months, and maybe even years, when you take that pressure off that nerve, it's still kind of crimped, and it does take a little bit longer for that nerve to recover.
So is that sort of an overnight sensation when somebody does develop a spur or even a herniated disc? Is it instant pain, or is that something that sort of gradually grows and then one day someone's like, wow, what just happened? But yet it had been growing for quite some time.
It depends on whether or not it's an acute event versus a subacute event versus a chronic event. So in the case of a disc herniation, that's typically an acute type of pain where you have a hole in that covering of that disc, which is called the annulus fibrosus. You can kind of think of it as the dough outside of the jelly donut. And that it's good to have the jelly in that donut, but if you have a hole in that donut and some jelly oozes out and it causes pinching of the nerve, that can be pretty instantaneous. And so in those type of conditions, like a herniated disc, we can try an injection, we can try medications, we can try physical therapy. In fact, I've had 2 separate disc herniations in my lumbar spine in my life, and it was the most excruciating pain that I've ever experienced. So I can completely empathize with the pain that my patients are experiencing.
Right.
But luckily, I had an epidural steroid injection, and it just really helped me.
Right, but that's
almost
temporary.
Instantaneously. That is temporary, but it can act as a bridge until that disc shrinks back. If all those things fail, then we can go in there with an endoscope, with this less than 1 hour surgery through 2 tiny little incisions, take out that disc herniation. The patient, in most cases, will feel relief right away. Mm-hmm. When it gets a little bit more chronic, like the bone spurs, as you were talking about, and a patient has had stenosis for quite some time, we can still take the pressure off the nerve, but those nerves typically take a little bit longer for them to experience the recovery. So the recovery in and of itself can be a little bit more subacute, because you're taking the pressure off the nerve, but it takes a little while for that nerve to recover.
Yeah, sometimes it takes up to a year, right?
It can,
for
yes.
Years for nerves to recover. What would you say in the case of somebody who has had multiple herniations? Sometimes 2, 3, 4 in a row. I know you said that you had 2. Was it on separate areas of the spine and neck, or were they on top of each other?
In my personal case, it was in the same level, the same side, actually.
Really?
Yes. So
is that possible?
It is possible because, as I mentioned to you, when you have that defect in that covering of the nerve or the disc called the annulus, that defect really doesn't go away, but the body can sort of create a little plug, so it minimizes the risk of it re-herniating, but that chance of it herniating from that hole, that annular defect, is always there.
Mm-hmm. Okay. And so a herniated disc can cause multiple different types of pains, right? You can either suffer from a headache, you can have loss of feeling or numbness in your arms, or it can go down your leg. How does somebody know, oh, this isn't just a headache, this is my discs are herniated, so I must go see a neurosurgeon? What would you say to somebody who develops any number of those sort of other types of pains that they wouldn't associate it with having a herniated disc?
Yeah, so the type of symptoms that you're describing is really dependent upon where that compression is occurring. So it's most common in the neck or the cervical spine and or the back, the lumbar spine, because there's a lot of motion that occurs in those areas, in your neck and in your back. Mm-hmm. So once a patient starts experiencing those symptoms, for instance, headaches in the back of the neck or occipital-based headaches, that can be caused by nerve impingement. And then if you start feeling pain that radiates or goes from the neck to either the shoulders or down to the arms to the hands, and it's also then associated with numbness, tingling, what we call paresthesias, that's probably related to nerve impingement in your cervical spine. Now, when you're talking about sciatica, that's typically a result of the nerves of the lower back or the lumbar spine. That's when those nerves get pinched off. So when they talk about the sciatica, that's typically nerve pain that results from impingement in the lower back or lumbar spine. And both can be pretty debilitating.
Right. All right, Dr. Rowe, I knew this wouldn't be enough time for us today, but let's let our audience know where you're located.
Yes, so we're in beautiful Aliso Viejo at 2 Journey Suite 200. And it's really right down the street from here, probably about 10 minutes away. It's 949-998-6625. And or you can reach us at excelneurosurgeryspine.com.
Fantastic. Well, I have more questions to ask you and more to talk about, so you have to come back.
Will do. Thank you so much.
Thank you. You're watching This Day on Village TV. We'll be back after these messages.
What if healing wasn't about masking pain, but restoring your body's ability to heal itself? At the Goswami Clinic, Dr. Gaurav Goswami has spent over 15 years helping patients recover using advanced stem cell therapy. Call today to book your consultation.
Welcome back to the show, everyone. Here to talk to us about regenerative medicine and stem cells from the Goswami Clinic. We welcome Dr. Gaurav Goswami to the show.
Thank you. Good morning. Thanks for having me.
How are you?
Good, good.
I'm so excited to talk to you. We've talked a little bit before we started the show, and you use the same word that I have in my talking points, which is buzzword. And I do think that we both agree that regenerative medicine, stem cells, those are definitely buzzwords that seem to be hitting multiple podcasts.
Yes.
Right? Everywhere you look.
Right.
It's just one of those newer types of phrases and words that we're seeing a lot. But let's get back to what you do and how you actually help people with regenerative medicine.
Right. So this is my 15th year of practice. I'm by training a surgeon and an interventional radiologist, and then also board certified in the American Board of Regenerative Medicine, which is a fairly new board. And the reason my career trended in this direction was because I was part of mainstream medicine. You know, I was faculty, University of Washington, Seattle, and then also director at Long Beach Memorial Hospital. But what I was seeing, especially in the area of orthopedics and sports injuries, we weren't really helping patients. You know, a lot of these patients would keep getting cortisone injections, steroids, which sort of destroy the joint, and then eventually they would move towards having surgery, and then the ultimate end stop was having joint replacement.
Wow.
And so I felt, you know, the functional outcomes after these treatments were not that great.
Right.
And so that is where I think regenerative medicine right now in its current shape and form has the biggest impact on how to keep you active for as many years as you're alive, and also help you experience a superior quality of life because you can play the sports, you can stay active, you can travel. And we're all headed in that direction, right? I mean, the wear and tear of life, right, takes. So this is not a disease process we're talking about, but we're talking about like really keeping people active for as long as they want to be.
Right. And so this, the whole regenerative medicine, stem cells, do you think that the medical community will eventually sort of take that same route that you have, or will they stay pretty traditional?
Right. So, you know, the devil is in the details always. So I think with anything new, unfortunately, sometimes marketing goes ahead of science. And it's unfortunate that a lot of places, you know, offer these treatments, but they may not be done correctly, or patients may not be seeing the benefits they want. Mm-hmm. So our focus at Goswami Clinic has always been about results. You know, I'm not a doctor if you're looking for another stem cell injection, but if you're looking for results, then yes, stem cell at the end of the day is another tool in my box. How it's applied, how the treatment is done is very, very important. So we need more success stories out there. And I think then eventually, yes, I do think like anything else, mainstream medicine will start having this. Already as part of the American Board of Regenerative Medicine, I'm a board examiner. I conduct training courses for other physicians and nurses who are interested in the field of regenerative medicine, so they can learn things the right way. Mm-hmm. But that's what we need right now, is more success stories, more people saying that this has benefited them. And I think eventually the walls of insurance and mainstream medicine will come down.
They'll have to follow suit.
Yeah.
So tell us, what are you mostly focusing on there in your clinic over in Newport Beach?
So most of it is, you know, joint pains, knee pain, shoulder pain, and then back pain. Those are our three commonest sites. Obviously, we treat a lot of other orthopedics, sports injuries too, you know, everything. And like I mentioned, stem cell is a tool in our box, right? Everything starts with a proper diagnosis. Everybody is not a candidate for stem cell treatment. Sometimes surgery is what you need as much as you want to avoid it. So everything starts with a proper evaluation of where the patient is, what the goals are. And then even the treatment protocol, if you're undergoing a stem cell treatment, varies from patient to patient, depending upon what their condition really is and what outcomes and results they're looking for. So everything has to be customized. It's not one size fits all. So a lot of planning goes into figuring out, and as a surgeon, I'm aware surgery has a role to play. So some patients do need surgery, and that's where we guide them.
So that's very interesting. So you're diagnosing on the very early onset of, you've got pain in your elbow. Let's say you've played tennis for 30 years, you've developed some maybe joint conditions, arthritis. And so do you take a look at that particular condition and say, okay, this is how far I can help you, and perhaps you don't need surgery, or maybe there's nothing I can do here and you do need surgery?
Absolutely.
So you're sort of walking your patient all the way through
Correct.
what's possible.
Yeah, it continues to baffle me how many patients actually are walking around with improper or incorrect diagnosis. And when the diagnosis is not correct, you're not going to know. Tennis elbow, could be as simple as an inflammation at the elbow. You brought up the elbow, and I was just talking to a patient last week. Or there could actually be a tear in that muscle. So a lot of patients will, undergo what their doctors will routinely recommend, either a cortisone injection or take some time off from their sport, but they're still not healing, and they're not healing because it's not. Luckily for me, my career has taken me through multiple specialties. So I do an ultrasound evaluation of the joint during the consultation, and then make a right diagnosis, and then if need be, we will send the patient for an MRI. But even in the MRI, I've seen sometimes the radiologist hasn't seen the patient. So sometimes the MRI report could be filled with a lot of redundant information, which is actually not the cause of your symptoms. And what happens is these patients, when they go to a surgeon, they're treating the MRI findings rather than treating the patient. So a lot of finesse and knowledge and experience is needed to apply regenerative medicine tools correctly.
Dr. Goswami, I can assure you nobody is taking the time that you are with your patients.
Yeah.
I feel that about you. It just feels amazing that you take so much, you have a lot of passion for what you do, right? And for the people that you care for, in order to take that amount of time and intricate detail into everybody's cases. Where did that passion come from?
I think, as a physician, I say that we spend a lot of years in training, a lot of years learning our craft, and then which I don't necessarily see as a positive, because we end up lacking a lot of other skills. We're not businessmen, we're not.
Right.
But at the end of the day, the whole purpose of being in medicine is to help, and I often tell people, if I was a businessman, I would probably be making a lot more money and giving a lot more to charities. But medicine is the only profession where my work is my charity, right? And when a patient comes to me and trusts their body, how often can you go and touch someone just out of the blue? You cannot, right? But when a patient comes to a doctor, he's really offering his complete trust to the doctor.
Absolutely.
And it's my job to make sure I don't let them down.
Tell us, what is PRP?
So PRP is platelet-rich plasma. Platelets are a type of cells in our blood. We have red blood cells that carry oxygen. We have white blood cells that fight infection, and then we have platelets. So when platelets have 10 to 12 very good growth factors. They're not stem cells, but sometimes that's all is needed. So we draw the patient's blood, we have to spin it to remove the red and the white cells, and then we're left with platelets in the fluid of the blood, which is called plasma, and that's where the name platelet-rich plasma comes from. And it's just an entry point into the world of regenerative medicine, but like I mentioned, there are a lot of patients who sometimes need just a good PRP treatment. The problem is there are 20 different ways of making PRP, and 17 don't work.
Oh, no.
So I write it in my book, so it's very important how this is prepared for what indication. Like PRP going into the joint is different than PRP going into a tendon or ligament. PRP used for shoulder pain can be very different for PRP used for plantar fasciitis. And then PRP has a lot of applications even in the cosmetic world, you know, the vampire facelift. That's exactly, they use PRP, but then that PRP has to be prepared very differently than the PRP. So I think as we do more and more procedures, we're learning more about the regenerative aspect.
And you authored a book called The Stem Cell Cure.
Yes.
So if our viewers want more information or want to read your book or find out basically what you're doing in your clinic, they can pick up the book. Where can they get a copy?
You can get a copy wherever books are sold, Barnes & Noble and Amazon.
Amazon.
And the whole purpose of writing that book was to educate the common folks, because as you know, these treatments are currently not covered by insurance. So, you know, not only patients are putting their trust, but also their hard-earned money and savings into these treatments. I wanted them to have, and then I highly encourage, you know, spend the $15 on the book before you go around spending thousands of dollars, you know, getting these treatments. So at least you will have an idea of the questions you should be asking your provider.
Well, with that, Dr. Goswami, thank you so much for joining me today.
Thank you.
I really
Thanks a
appreciate you
lot.
being here.
Thank you very
The
much.
Goswami Clinic in Newport Beach.
Thanks.
You're watching This Day on Village TV. We'll be back after these messages.
For some places, care is a service. At Heritage Point, it's a commitment. Located in Mission Viejo, Heritage Point offers an environment where residents feel known. This is where community thrives. Visit our website or give us a call to schedule your visit today.
And welcome back, everybody. We got some good movies for you for today, and we want to talk about it right now. It is Saturday's movie. It's 10 North Frederick, and it stars Gary Cooper from 1958. It's brought to us by Advanced Ear Care. It's going to be at 2 p.m. with the subtitles and 6 p.m. without the subtitles. Following her father's funeral, Anne reflects on his final years, marked by political decline, an unhappy marriage, and drinking, only to discover that he had experienced one secret period of joy and romance in his life. Well, that's a kind of an uptick for that funeral story there. This should be a good one on Saturday. I've never seen this one, so it sounds like a good one. If you haven't seen it, make sure you watch it. It's going to be at 2 p.m. and 6 p.m. today. Okay, let's take a quick check of the weather before we head out. And we got some nice temperatures for today. If you're not going to stay in and watch the movie, go out there and enjoy those temperatures. 78 degrees is going to be your high today. 75 degrees on Sunday. And then we got some cool weather coming in from Monday, Tuesday, and Wednesday. Look at that, back down to the upper 60s on Tuesday and Wednesday with a few clouds in the forecast, but no rain. We had that earlier, but now it's gone from the forecast. Monday on the show, we have a CEO update, as well as the folks from Poetry and Jazz Club are going to be here. I'll be here as well, if you can stand it. That's going to do it for this edition of This Day. I'm Michael Taylor. For all of us here at Village Television, we hope you make this day a great one.